Hello, I am Beth Ann Clayton and I am representing the AANA Foundation Abstract Task Force. I will be reviewing the evidence-based practice and quality improvement poster abstract submission process. The AANA Foundation Task Force is charged with monitoring the abstract process and adapting it for improvements. The task force evaluates the current poster abstract process and identifies gaps in the application process, in the criteria for each category of the abstract, and guidance for the reviewers. The task force implements suggested changes to the abstract process and creates educational videos for applicants and reviewers. Updates to the poster abstract submission process starting in 2026 includes a revised word count of a total of 325 words. This is a significant reduction compared to previous abstract submissions. In addition, there is an improved structure, including the purpose and question, methods, results, and implications and conclusion. The AANA is moving to an AMA reference style for abstract submissions instead of utilizing the previous APA format. And lastly, there is an opportunity for publication of Congress oral research abstracts with their findings in the AANA Journal. There are three major categories of poster abstract submissions. Research, which includes qualitative and quantitative research, evidence-based practice and quality improvement projects, case study, or innovation. I will be reviewing the evidence-based practice and quality improvement project abstract submission. Please use the following questions to determine if your abstract should be submitted to the non-research category of evidence-based practice and quality improvement. First, you need to determine if your project is an evidence-based practice project, a quality improvement project, or a literature review. Evidence-based practice uses the best evidence from published research studies and combines it with clinical expertise to answer a specific question and guide clinical practice, resulting in the best patient outcomes. A literature review is a survey of scholarly sources on a specific topic, and it provides an overview of the current knowledge. If your project is a literature review, it is not eligible for abstract submission. If your project contains a clinical question in the PICO or PCOT format, then you are submitting an evidence-based practice project abstract. If you have provided evidence from the literature and combined it with clinical expertise to answer your PICO or PCOT question, it is an evidence-based practice project. If you have implemented the evidence into clinical practice, or if there is a plan to implement the evidence into clinical practice, you have an evidence-based practice project. If you do not have a plan for implementation or you have not implemented, this is considered an incomplete evidence-based practice project submission, and it will not be accepted. Quality improvement is a data-driven strategy to improve processes, costs, productivity, and outcomes within an organization based on evidence from the literature. The focus is on the current structure within the institution that needs to be changed. Thus, your project qualifies as a non-research category in quality improvement if you are able to answer yes to the following questions. Does your project improve internal systems or processes in an organization to improve cost, productivity, and/or quality outcomes? And has your project been implemented, or is there a plan to implement your project? The abstract is not eligible for submission if it is purely a literature review, or if your project has not been implemented or a plan for implementation has not been described. The evidence-based practice and quality improvement abstract format includes the following. First, the word limit has changed and you cannot exceed 325 words total. You will begin with identifying the purpose of the evidence-based practice project or the quality improvement question clearly and concisely within 45 words. Next, in the methods section, you will describe the implementation plan and the quality improvement framework if it's applicable, the evaluation methods you used, and the analysis strategy. For projects that were not implemented, you must describe a plan for implementation and analysis. This must all be accomplished within 100 words. The results section should include a description of the key findings of analysis in a factual manner with specific data points, including demographics, noting any themes that emerged from the analysis. For quality improvement projects, provide results of statistical testing if conducted. If your project was not implemented, you will not have a results section. Lastly, the implications and conclusions section. You want to describe the significance and implications for practice. For quality improvement projects, ensure the conclusions are supported by the results and minimize overgeneralization. This should be accomplished within 70 words. Next, I will review the components of the non-research scoring rubric for evidence-based practice and quality improvement projects. First, the reviewer will determine if the abstract is worthy of acceptance. If the reviewer identifies that there is a critical flaw or weakness that would preclude the abstract from being accepted, such as inclusion of inaccuracies, incompleteness, identification that the abstract is a literature review only, or recognition that the project has not been implemented or a plan for implementation has not been described. The reviewer will note the critical flaw or weakness and explain their concern. Next, the reviewer will go on to score the remaining of the abstract rubric. The purpose and question section of the abstract submission should not exceed 290 characters, including spaces, or be less than 45 words. The reviewer needs to determine if the title reflects the project, if the project's purpose and goals are clearly defined, if the significance of a healthcare problem is well established, and lastly, if the significance of the problem is supported by evidence from the literature. The methods section should not exceed 600 characters, including spaces, or be less than 100 words. In this section, the methodology should be clearly described, along with an implementation plan or process for implementation. In addition, a plan for data analysis and/or evaluation should be described. Research ethics will be addressed separately in the submission outside of the abstract text. Next is the results section. If your project was not implemented, but only a plan for implementation was described, the results section will be omitted. If your project was implemented, the results section should not exceed 700 characters, including spaces, or be less than 110 words. The results should be reported in a clear and concise manner, and the results should be aligned with the project initiative, purpose, and goals. The data analysis should support the results, and the interpretation of the results should be sound. Finally is the implications and conclusions section, which should not exceed 400 characters, including spaces, or be less than 70 words. This section should include the implications and recommendations for clinical practice, and the limitations of the project should be adequately discussed. If your project was implemented, the discussion and the conclusion should be supported by the results. The reviewer will also assess writing style and format. The reviewer will determine if the abstract guidelines were followed, if AMA format is correct, if the grammar and punctuation and sentence format is appropriate, and if the abstract is logical and well organized. A few tips and tricks for successful abstract submission. Be sure to follow the template to ensure all required sections are included. The reviewer's rubrics will evaluate each section of the abstract, and if the template is not followed and a section is missed, the reviewers may give a score of 0 for that section, which will decrease the likelihood of abstract acceptance. Have a trusted person review your abstract, such as a faculty member or a peer who has published. And lastly, be sure to watch your word count. It is important that your overall word count does not exceed 325 words. Simply and clearly describe why your project matters. Why did you undergo this project, and why is it important? Be sure to clearly describe what you did. If you implemented a project, make sure you describe how you analyzed the data. Tips and tricks for the reviewers include: review every abstract as if it were your own. Provide comments to justify a no response or a score of 0. Overall, consider the following. Is the question clearly stated, and is it important? Is the method appropriate and well described? Are the results clearly presented and supported by the data? Are the conclusions supported by the data and appropriately limited? Is the abstract written in a clear and concise manner? And finally, is the abstract topic in the scope, or is it a good fit for the meeting? On behalf of the AANA Foundation, I wish to extend our sincere appreciation for your time, expertise, and commitment to ensuring excellence in scholarship.